Hello, everybody who is now joining us for our webinar, Formats of Radical Healthcare. We will just wait some minutes for everyone to come in and check in. Hello again, everybody. We are just waiting for 1 or 2 minutes more so that everyone has enough time to come into the webinar. Hello, everybody. I would like to welcome you tonight to our Zoom webinar, Formats of Radical Healthcare. My name is Yvonne vom Ferrer, and I am part of the team at the Badische Kunstverein, and I am really happy to welcome you tonight here. This panel discussion is part of our program series, How Do We Care? We want here to have a look of the politicization of bodies and to have a closer look on alternative concepts of caretaking. And this whole program series, How Do We Care?, started in October together with an exhibition and a library in the atrium of the Badische Kunstverein. This is where I am sitting right now. Here in the background, you can see it, our exhibition room, which is now unfortunately closed due to the actual COVID-19 regulations. And we switched all of our program to a digital format, and I am very happy that we can have this Zoom meeting tonight, this webinar. And I am happy that you joined us here. Tonight, we want to have a talk about various artistic, feminist, and activist formats, and to talk about our understanding of health, both on personal, political, and societal level. For this, I want to say hello to all our panelists, who are Inga Zimprich from the Feminist Healthcare Research Group, the creative research project Power Makes Us Sick, Laura Lulika from the Sickness Affinity Group, and Luise Menz, Sophie Pischel, and Lena Würschig from Formate des Dialogs, Formats of Dialogue. Thank you very much for joining us tonight on webinar. I also wanted to introduce my dear colleague Mira Hirz, who is one of the co-curators of the exhibition and the program series. And tonight she will moderate our panel discussion. We will have a short introduction round where every panelist is introducing their work. And then we would like to open the discussion and the talk to everyone, and Mira is going to moderate that. All attendees are invited to give in their questions via the Q&A function of the Zoom webinar. And Mira is going to collect them, and we will give in your questions to the panelists in the later discussion round. So to give you this overview, we will start with 10 minutes for each participating group. I will also give a note when 10 minutes come to an end to make sure that afterwards there's enough time for us to talk all together about the methods and formats. And after that, I will give up to Mira, who's moderating this. You can send us in questions anytime, so when you're hearing during introduction round something interesting or have a question for that, you can put it in the chat function every time, and we will take care of that later in the discussion round. Yeah, in this discussion round, we want to focus on our understandings about healthiness and sickness, about different formats and methods about radical healthcare, about how to share knowledge, how to give access to assistance and aid, and of course also how the COVID-19 pandemic has changed our working methods and what experience it has taught us. So then I would like to start immediately, and I would like to give speech to Inga, who this morning already gave a workshop online for our program series, and she brought also some pictures which I will now going to share. And yeah, I would like to start with you to tell something about the Feminist Healthcare Research Group.
Hello, thank you, Yvonne. Thank you, Mira. I'm also really happy to see friends and not see friends on the screen. Very happy to be on one panel with you. Can you hear me okay? Is that fine? So I'm a bit exhausted and I have a bit of back pain, but I'm looking forward to talk to you. I'm giving you a brief overview about the work of Feminist Healthcare Research Group, and I hope that in the later discussion we can maybe ask the more relevant questions now, like, well, the more relevant questions. We will come to them. So Feminist Healthcare Research Group right now is a duo of Julia Bonn and me. We are both artists living in Berlin. We both have other professions. Julia is also a body worker and I'm training as a deaf-blind assistant. And in 2015, we initiated a larger group of cultural workers who would get engaged or busy with questions around healthcare. Basically, we felt that the field of healthcare is like omnipresent and very intimidating and very strongly controlled by experts, intimidating non-experts to get busy with their own health, with their mental health, with how we navigate emotional crises, how we sense into our bodies, our needs, and our vulnerabilities. And we came together as a larger group of 12, 13 cultural workers who wanted to develop a practice of collectively engaging with these topics. And the methods that we developed were to learn from visiting places and exchanging with places and people who were running initiatives of alternative and radical healthcare in Berlin, like radical counseling places or radical therapy, alternative health places, feminist health centers. Also reading a lot of publications from the 70s and 80s that were often published in a very guidebook manner, in a straightforward manner, so that you could experiment and like try out practices. And we started to publish zines, like little leaflets that we were producing ourselves to write down about our encounters and meetings, but also to offer exercises that we found useful and that we were using ourselves to check into certain topics and check in with our history around experiences of sickness, of vulnerability. And we started to build up a little library of publications that we came across, of self-published zines and often publications from the 70s and 80s. And the pictures you're seeing are a bit, well, maybe we're going chronologically backwards. At some point, we understood that the different places we had visited in Berlin that we found very encouraging and inspiring, that people like were running amazing counseling services, anti-psychiatric places like the Runaway House. We understood that they were all founded in the late 70s and early 80s, and for the first time understood that something like the health movement had existed. And we, for 2 years, we have been working on doing talking to people who were active in the health movement and trying to portray or present initiatives they had been running. Many of them are still running and operating today, like the Feminist Women's Health Center in Berlin, or Heiler House, Healing House. We also spoke to people who had run a collective pharmacy in the 80s, pharmacist collective. There's still a doctors collective in Berlin. And we just gathered a lot of just very inspiring models of practice, how healthcare can be done differently. I forgot to say something. We did not continue as this large group. We ran into big conflict after a year, and 3 of us who were all Berlin-based and white and parents, we were continuing working in Berlin. And our life situation had a strong impact on the way we were working. Namely, understanding at that time we were all mothers of very small children at that time. And we were all trying to cope with the fact that we just didn't have that time anymore that is needed to work in the very underpaid, very precarious field of art in the same mode as we did before, which means to work extra hours and work short notice and work during the nights and be hyper flexible. But we felt that with having this care work to attend to, that our rhythms and capacities had just changed enormously, and we began to adjust our working process to our capacities. I briefly show you, oh yeah, you saw it. So we published a zine with interviews of people from the health movement. Yeah, that was just very rewarding for us to meet a lot of people that just, yeah, gave that do encourage us. And we also began to give workshops as a way to pass on methods and practices that we learn from other people, that we learned very much from literature from second wave feminism and from the health movement. And in the last 2 to 3 years, we are gaining much more knowledge and insight from disability justice movement, largely from the US and from Black, of color and indigenous people, as well as from people active in disability justice frameworks. And we are grateful for being able to learn so much in formats as podcasts like How to Survive the End of the World, or readings from Leah, Lakshmi, Pipnya, Samarasinya, and other people. Just to mention also people who are part of Sickness Affinity group. Yeah.
Inga is saying that that's about 7 minutes, so you have an idea.
Perfect, thank you. Yes, and you see some pictures from workshops that we gave, and most recently we were part of the Berlin Biennial in Berlin, which was like quite a step for us to kind of go into the, what do you say, that the stomach of the whale or something, like to go right into where these art market things are happening. We started a project in November that was running till January, and we gave a workshop in December on how to be in crisis together. This was just a kind of hot topic in Feminist Healthcare Research Group all the way. How can we create more space to share vulnerability and needs in frameworks where we meet as cultural workers? How can we kind of end that idea that we are all coping and that we're doing well and that we manage those like extractive expectations? And we published this zine that you briefly saw, Being in Crisis Together, with illustrations by Tina Carden. But since then, the COVID-19 pandemic hit, and I must say that the interest in people working on issues of health and care in the art field has increased significantly since then. And my big question is whether that's going to have any structural impact on how we do things in the art field, and whether we are committed to reflect the way our artistic practices are often excluding others, how they have this ideal of productivity. I wonder, and I hope we will manage to break with our own competitiveness and our readiness to produce. So that's maybe my positive hope or expectation from the art market turning towards the topic of healthcare and care. But of course, I also have a negative perspective on it, where I just really hope and call for us taking this serious and engaging with people who are strongly affected by healthcare crises, who are depending on healthcare and on assistance. And yeah, I think now I'm at 9 minutes and 45, something like that. So maybe that's it for now. And I'm happy to pass on to all of you and hear more about your practices.
Dear Inge, thank you very much for this introduction about the work and about your work and the work of the Feminist Healthcare Research Group. Let us continue directly. I would now like to give speech to the creative research project Power Makes Us Sick. They are operating as an anonymous group, and I would like to ask you now to tell us something about the topics and the work you are doing.
Thanks. So I'm just going to share some images here. I think this is working. You can just see one image, no? Yes. Okay. Great. So there's two of us here. So I'm going to speak for a bit, just basically answering a bit of what our process is like. And then I think my cohort is going to respond to that in more detail. And then hopefully, if there's time, I will again talk a little bit more about one specific tool that we've been working on for some time called the accountability model. So I think as has already been mentioned, we are a creative research project that focuses on healthcare, autonomous healthcare from a feminist perspective. And so one of the main things that we do is that we just develop and circulate sort of the good news of autonomous health. And by that, we mean the support and care that we offer one another outside of the state and institutionalized medical systems. And one of the primary ways that we share this info is in the form of our zines. And this usually includes like report backs and sort of guides and some of our own reflections and theory that's relevant to each issue. And so we have our regular zines that sort of loosely follow a theme, but we also have more recently been interested in making smaller publications that focus in on one particular topic, such as the zine Building Towards an Autonomous Trans Healthcare, which you can find on our website for download if you want. Little plug there. But we're also in the process of working on a zine focused on emotional support from an abolitionist perspective. And if people have thoughts on that, they can reach out to us as well. So in the past, before COVID, we also put together workshops and sometimes larger groupings of like skill shares and more like workshop events. So for example, what that might mean is like, it can vary. We used to have a workshop around death and dying that we did with people to kind of, you know, move through grief and understand how we can weaponize those feelings. We also have done trainings on the basics of autonomous emotional support. We've done that a few times. And so, for example, we've also helped walk folks through our accountability model process and help set it up and see that through. So, and then one of the other primary aspects of our work is the support that we do on the ground. So like individually, each of those in the collective has some of our own healing practices that we participate in, or we're engaged in some kind of like mutual aid and care work in our own lives as medics, healers, care workers, this sort of thing. And that definitely informs our practices together, and the sort of like networks and relationships and knowledge that we learn from practicing individually does end up informing the zines that we do together. But we also really love to respond to requests for support within social movements together when that's available to us. And that's sort of like one of the primary ways that we learn, is just by trying out different practices that we've come across, and implementing different strategies, and just like learning by doing, by trial and error. And yes, also I will say that lately we've been interested in being more involved with mutual aid projects that might involve like the sharing of harm reduction resources or medicine. And yeah, so that's a little bit of an overview of the kinds of work that we do. And let's see, I guess I should just say that we also always want to emphasize that when we're talking about autonomous health, we focus on mental, physical, and social health. And those are not necessarily distinct categories, but we are interested in trying to shift our collective understanding of health to include the social aspect, right? So yeah, the health of the social body is definitely like intimately tied to our individual well-being, but it's like often overlooked in most of the ways that health is practiced today. And we want to do what we can to kind of care for that and be connected to, and have that be connected to the care that's done for the individual. Yeah, it's very often ignored. And I think with that, I will pass it off to.
Yeah, I can go ahead. And you want to keep screen sharing the image up? Great, thank you. Thank you everyone for the introductions. It's very exciting to be here. Hi, I am a member of Power Makes Us Sick as well. So our collective is called Power Makes Us Sick because the foundation of what we do is identifying the ways that experiences of illness and sickness of any kind can't be decontextualized from experiences of oppression, and also those kinds of attempts to decontextualize and individualize illness are one of the ways that structures of oppression operate. So obviously illness involves real processes in the body, but the full reality of it, when we look at that, also has to include what happens to and around our bodies, and how that's shaped by our culture's standards of what is considered normative for bodies and for health, and what purposes those standards serve under capitalism. Looking at a full picture of everything that affects our health and how we think about what makes us healthy or sick in the first place. We've often described our collective as anti-national rather than just international. We don't happen to just be located in different parts of the world. And our work happens across borders because we work against borders, and we see borders in all of the borders of nation states, the borders around citizenship that limit one's access to care, and the borders of that gatekeeping forms in medical establishments that keep people from having access to care in the first place or having knowledge about our bodies. Our practice of autonomy is something that we emphasize in the way that we work as a collective. I think my friend mentioned this previously, but when we share all of these resources, when we put them together, we're speaking from our own experience of doing work, extensive research and knowledge that we have. But all of this is part of a conversation that we want to have with everyone who uses our tools and everyone who engages with our work. So we really always want to hear report backs from people's own experiences, from people who've tried to put these kinds of tools into practice and how that worked for them, so that everything we can create can constantly be changing and evolving, so that we don't turn the process of sharing knowledge into a process of limiting knowledge in the way that conventional health and medicine often do under capitalism. All of us have our own experiences of illness in one way or another. We are people with mental health issues, who are neurodivergent, who live with chronic illness and trauma. And in addition to being something that we speak from when we talk about these topics, it's also a way that we let care determine the way that we work with one another, that sets the pace that we work at so that we can support one another and prioritize the well-being of people in our collective and anyone that we're doing work with over things like deadlines and getting the work done. And if we are still doing all right on time, we can elaborate a little bit on what some of our tools are and what those look like.
Would have about a minute, so if you would like to tell us shortly about this, you're very welcome.
Sure. So we were thinking we could elaborate on the accountability model, which I will just say is an experimental model for support and taking care of one another's mental, physical, and social health that involves developing small groups to work together to research options, identify and build community resources around healthcare, and implement support those seeking and offering care are fully aware of and consenting to. And it can be adapted in a holistic sense or as a sort of a transitional help step towards caring for one another, independent of the other sort of uglier systems that we were talking about. There's a lot that we could say about why we wanted to create such a document and what some of our inspirations are, how it's structured, how we imagine it can be implemented, and some of the magic that we think could happen as a result of it actually being implemented on a larger scale. But I guess I'll just say that we can put like a link to it somewhere for those of us listening if people want to hear more about that. Or you can reach out to us if you want more info about how to put it into practice in your networks and communities and with your friends. Yeah.
We can also come back to this later in the discussion round. Thank you very much for introducing us to your work. And now I would like to give speech to Laura, who is tonight representing the Sickness Affinity group. I am happy to hear something about the work and you and the other art workers and activists are doing in this project.
Yeah, so firstly, just to say, I mentioned before to the panelists that I'm very pregnant right now. I'm 8 months pregnant, so I'm extremely uncomfortable and out of breath. So I'm gonna try and speak quite slowly and give my lungs some space. But I'll give some background on Sickness Affinity Group as a collective. So we operate in a number of ways, and we came together initially around 3 years ago. We were a combination of artists, cultural workers, activists, social workers, healthcare workers. And we started meeting on a bi-monthly basis. We were originally meeting in Healing House in Berlin that Inga mentioned before. And there were members of Feminist Healthcare Research Group, PMS, and also another creative collective called Coven, which is also based in Berlin. And we started to meet on the basis that we noticed that there were often times where we would be competing for the same opportunities, the same limited resources, and that often there is a tendency for art structures to replicate capitalist working structures, which is something that none of us were interested in doing. And we wanted to counteract this by meeting together, talking about what we were up to, and finding ways to share resources, share opportunities, share support. And we were also meeting up as a general support group as well. So there was a lot of people in the group who have caring responsibilities, who have personal experiences of chronic illness and disability, and mental health issues, or working in care roles. And so we were also meeting up as a support group to share resources based on these topics more generally, also outside of art and culture. And I think what's kind of funny about the group is that we really started with this very clear mission that we really didn't want to be a production-based group at all. And I can see Inga smiling because we had this very clear mission that we would maintain as more of a support group and work casually together on things if we felt like it. But it just, I guess, happened that many of us enjoyed working together. Occasionally we would get some opportunities to work together. And so there is an element of Sickness Affinity Group, which has become a working group also. There are many artists and cultural workers within Sickness Affinity Group. So when we have opportunities, we like to share them or extend the invitation and collaborate. Sorry, let me just get my breath. And yeah, so we the way we structure it is that we still continue with our bi-monthly support meetings, and then we also have break-off garden project groups. And so if we do get an opportunity to work together, then those in the group that would like to work can, and those that don't want to don't have to. And so the working side of the group is always optional, and we try to focus on working together in a way which is very caring, which prioritizes the access needs of everybody in the group, which has an awareness of also the access needs of who we'll be working with, for example, and the accessibility of the space and the project to participants or people who would visit the project or be involved in the project. We have also worked on some publications together and public events. So one of those is the Fatigued Oracle, which is a format that we created, which is kind of in the style of an agony aunt. I don't know if like that's also a thing in Germany or if that makes sense. An agony aunt, like somebody that you write to maybe in the newspaper with like a personal problem that you're having, and they'll give you their advice. And so the way we do it is that anybody participating in the event in SAG or a participant can be the oracle. Everyone is the oracle. And people who are having an issue can ask a question to the group, and somebody can give a caring response to that. And it will be usually an issue around access or an interaction that you had with access and work. For example, like if you gave a space that you were possibly going to be working with your access needs and they didn't respond in a very caring way, or they didn't respond at all, like this is an example of one question that somebody gave to the oracle, and then somebody from the oracle would, you know, respond in a caring way with advice. And this is a format which we've done publicly as part of the biennial project that Inga mentioned with Feminist Healthcare Research Group. And it's also going to be turned into a printed publication, which I think will be ready by the beginning of next year. What else is there to say? Also, the group is organized by 12 core organizational members, and the support group meetings, which happen bi-monthly, are open to anybody to attend. At the moment, this group is sort of ever changing, ever fluctuating, always under negotiation of what our identity is, how we work together. This is something we are also reconsidering now under the current kind of conditions of the pandemic, because we've had to move our bi-monthly meetings online to Zoom. And I think that there can be a tendency often to presume that online equals accessible. And actually it doesn't, you know, digital spaces are not accessible to everybody. Often the most marginalized people don't have access to digital spaces. And so we have found this quite difficult. Also, Zoom can just be very exhausting in general, which I think everybody probably has realized by now. It has a lot of positive elements. I think that we are able to have an element of connection, but it's not like this perfectly accessible platform. So this has been a really difficult element to contend with. Also, as our group kind of ages, we're getting bigger and bigger. I think at the last bi-monthly meeting, there was around 25 people, and it's also a very difficult thing to contend with, is like, how do you support 25 people in a Zoom meeting, you know? And so this is something, you know, we're also trying to figure out. So we are in a kind of transitional phase at the moment, and taking time to consider sort of internal conditions of the group, which is also really important, because when you think about the group's organizers, you know, we are a group of people who have personal experiences of chronic illness and disability and caregiving responsibilities. And so to find a way, okay, thank you.
So if you would like to close with 1 or 2 sentences.
Okay, thank you. And so we're also spending the time reconsidering how we can be supportive of each other and also maintain this support meeting element and how that can work online. And we're also spending the time on how we can work together with, as Inga mentioned, this growing interest in the topics of sickness and care, and whether we are able to, and whether we have the capacity as a group to continue to accept invitations of work and still find ways to care for each other and our access needs. So yeah, I think that gives basically a roundup of where Sickness Affinity Group are at the moment. Thank you.
Thank you very much, Laura, for talking about the Sickness Affinity Group and the formats, and also about the Zoom topic we are all now working all together on. Yes, I would like to remind the audience if they are invited to give in questions anytime. We will come back to them in the discussion round after our last discussion, but if there's something on your mind and a question which is burning under your nails, you can already give it into the Q&A part. So I would now go, last but not least, to Luise, Sophie and Lena from Formate des Dialogs. And yeah, the three are communication designers, and I'm really happy to hear about the work of Formate des Dialogs.
Hi, I'm Sophie, and I'm working together with my fellow students and friends Lena and Luise, who are sitting right now next to each other in Halle. But before we introduce ourselves and our project, Formate des Dialogs, we would like to thank the team of Badischer Kunstverein for inviting us, because we are really, really happy to be here. And yeah, like I already mentioned, Lena, Luise, and I are studying together. We are studying communication design at Burg Giebichenstein Kunsthochschule in Halle, where we started our project Formate des Dialogs last autumn. We are working on topics around the German healthcare system, especially its accessibility for women with flight and migration experience. And generally speaking, health contains an extremely wide and diverse scope of themes, which affects all aspects of life, and therefore it is a highly political topic, and especially the health of refugees and migrants is often instrumentalized to maintain oppressive and deterrent politics. And in addition, women's health is a fundamental base for emancipation and empowerment. And yeah, this is why we soon realized that we wanted to dedicate more time to this important topic than the usual framework of a one semester project can provide. So we decided to define Formate des Dialogs as a long-term project without a clear deadline, but with the freedom to follow a research-based approach. Also, all this was quite a new field for us to work in, and therefore raised many questions about our role as designers and the way we understand design. In order to give you a clear idea of what we have done so far, Lena will now show you a quick overview of our process.
Hi. Yes, it all began with a conversation with a practicing genealogist from Leipzig in October 2019, who has been treating patients with experience of flight and migration for many years. And since then, at the latest, we felt the need to learn more about this topic and see more perspectives, and yeah, to deal intensively with the conditions in the German healthcare system, and especially in the area of women's health. We did a lot of research and tried to get an overview and conducted many interviews with people involved in this area. And yeah, as Sophie said, we have quickly realized that it is important to dedicate ourselves to this very complex topic for a longer time. Therefore, we gave the research a lot of time, and yeah, still do. And in order to acquire knowledge and an understanding for different perspectives and experiences, we pursued various approaches. Besides literature and web research, our focus was based on getting in touch with people who are active in the field of women's health and who are involved in working with people with flight and migration experience. And apart from the interviews, we initiated a website, for example, about the project, and conducted a survey among gynecologists in order to get a better insight into consultation and treatment situations between doctors and patients. Following the phase of collecting and processing, we felt the need to make our current state of knowledge in some way public and accessible in the form of a publication. So our publication is called Power Statt Aua. And yeah, we freshly printed it 2 weeks ago. Later we will provide also a link where you can download the digital version of our publication if you're interested in. And yes, this publication is part of a bigger project, and more formats are planned. And it is aimed at actors and is intended to give an overview and understanding of the topic. By presenting external resources and positions, connections are to be clarified, and inspirations and processes are to be stimulated. In this way, we would like to support actors and interested people in their commitment. An important part in the publication was also to reflect our role as designers, especially as female designers in a topic like this.
Yeah, so working on this project affected our understanding of design practice significantly, as communicational design is not exactly an easy term to define, as it describes a great variety of methods and techniques. And actually, for us, studying is mainly about understanding the meaning of our practice more and more, and finding an answer to what do you actually do. So when we started the project, we didn't really know where it was going and just decided intuitively how to proceed. But doing so was sometimes a challenge, as we are kind of used to stop researching at some point in the semester to start creating an output that we can present at the end of the semester. That's why we have also asked ourselves questions like, what defines the methodology that communication design is based on? What are our skills? What is our motivation for the project? And how do we want to work? So what we did so far is mainly gather information to understand the topic ourselves, discuss specific requirements to improve the situation, and find a path to continue for ourselves. And to do so, we formulated 5 aims that we want to follow. For example, we want to support refugees and migrants to being able to make decisions for their health without dependencies. Or we want to offer a platform for refugees and migrants as well as actors to share their needs and to promote a dialogue with one another. And these sentences are deliberately generic, as we always want to refer to the whole extent, keeping in mind that most of the problems refugees and migrants, as well as actors in the field of women's health, face are structural. So in the future, we will, together with other persons and groups, initiate formats to pursue the idea that comprehensive women's health care and the associated knowledge about one's own body are meaningful and fundamental for self-determined decisions and emancipation. Yeah, so that was all for now. Are we early?
You would have a good minute to go if you would like.
Yeah, I think it's fine. We can also go into questions. And
okay, then I thank all of you very much for these brief insights into your work, your methods, the topics which you're working on. And yes, now we would like to open the discussion to all attendants, so you can give in questions in the Q&A part, and I would like to pass the conversation to Mira, and I'm sure she already has a question for our panelists.
Yeah, thank you very much, Yvonne. Thank you very much to all of you for presenting your work. I just want to say again that now you can, so all the attendees, you're very welcome to send any questions into the Q&A, and I will have a look at them. But of course, you're right, and I do have many questions actually. And the last minutes I've been trying to figure out which one is the most burning for me. And I will. I think I would just start with this one because for many of your presentations, I heard again, and I was quite happy to hear that you're obviously looking a lot at the relationship of working and caring, and how can you do your work in a way which is caring for yourself, for your collective, for the other people. How do you maintain that? How do you communicate that? And I think this is exactly, here is a question, and it's not to any one of you specifically, so feel free to, you know, just take the word if you want to say something to it, is about how do you, or do you try to also communicate that to external people? So if there are people coming and, for example, offering you work, how do you then kind of make sure that you may not respond to conditions like, especially maybe some institutions in the art field or also other institutions are used to, but that you kind of want to bring in some reflection, that you want to bring in some conditions from your side, because either you need it or you really want to stress them and underline them because they're important. Do you have conflicts with that, or how do you deal with that? Inga, do you want to say something? Yeah.
Yeah, I could go. Yeah, I have the feeling that it's been a process of growth in Feminist Healthcare Research Group to understand that when we don't raise these issues, spaces remain, and even if we raise these issues, spaces remain inaccessible for people. And I would like to point at the primer for working with feminist and activist groups by Romilly Alice Walton, who's been writing a primer for groups to think about how they could relate to access needs. And Romilly writes in that paper that there's the experience that groups are not prepared, they are not anticipating that people with disability could come. And that also means that people with disability, with access needs, with chronic illnesses, with care obligations have to educate the frameworks in which they would like to enter and engage and participate. And that is always like a lot of emotional labor, and it requires a lot of work from people. And I experienced that when we are in contact, for instance, with a big apparatus like the Biennial, that it is continuously necessary to go all the way to check, like, is there accessibility info? Is it, how is the sound situation in a space? But also, how can we make people more comfortable in formats that we don't need to always stand, or that people with anxiety to be in spaces have the right to be there? So I have the feeling that, let me put it positively, that I have hopes that this is internal work that every institution needs to do, you know, and I think I have hope that this is starting to become, to be understood, that this is work that needs to be done in all the places, so that the people coming do not have to take, do not have to make the effort to do all that labor for institutions and persons, right? Institutions consist of a lot of individual people who can engage with that already by themselves.
Yes, thank you. Yeah. Yes, Laura.
I would just add as well to that I think I completely agree with everything that Inga said, and that I think also that the information is out there. Like, the disability community have already done so much work which is readily available for institutions to be able to look at and to be able to learn from and act on. There's a couple of projects that I just wanted to highlight. One of them was a collaboration between Invalid Art and Bella Milroy, who are both disabled activists and artists. And they did a small collaboration that was about putting a note in your email signature, for example, which makes very clear your working boundaries. So for example, like, if you have a chronic illness, or if you have caring responsibilities, or a disability that you may not, even something as basic as, like, you might just not reply to emails as quickly as able-bodied people, for example. And so this is a really nice project that's worth taking a look at. And something else is the access docs for artists, which I think was done by the CRIP Research Group in the UK, which is a group of artists and activists with chronic illnesses and disability. And they have a lot of examples on their website of access docs of different artists. And I think this is also something that institutions should really be getting used to if they want to be working with these kind of topics, is also taking care of the access needs of the people that they're inviting. And so this project encourages artists or cultural workers, anyone working with these kind of creative institutions, to write an access doc so that you have very clear boundaries from the beginning about how you would want to work together.
Thank you. It's interesting. I myself don't know about so many of these initiatives, so it's super great to learn something about it. I actually do have a little bit of a follow-up question, so I'm just gonna do that. It's not quite following up to that exactly, but for me, it kind of comes up with it. It's also about accessibility to knowledge. And actually, I'm looking a little bit into like Formate des Dialogs, maybe for beginning even, for an answer if you want to, because I think on your website I also read where you give a little insight in your project that you also encountered very often that it's about, or the problems arise with a lack of information, flow of information. So it's not only that things are not available, it's also that people just don't know, and they don't know what they're allowed to do or what they have the right to do or to get to. And I think this is also something that all of you have been talking about. And maybe it's just me wanting to put it in two different categories, and it's not actually two different categories. But I kind of feel there's a point where things are not available because they don't exist or they're not being put out. But there's also something about that you just don't know. There's no information about what you can actually go for and what you could actually ask for, or just say what you need or want. So I don't know if Formate des Dialogs, if one of you maybe wants to say a bit about your experience with that.
Yeah, so I mean, it's absolutely true what you said. That's also what we heard from the people we talked to. And yeah, I don't know what we should add.
And for example, that's why we had in our publication, we have a list of resources, because they are like great projects and tools and like everything, and very interesting stories about all these things, but nobody knows them. And that's, I think, sometimes the problem. And that's how we try to try to solve this problem, for the lack of knowledge about great projects.
But maybe I can ask, is it a lack of great projects? Sorry, Inga, in a moment. Is it a lack of great project, or is it also about, because I remember you saying something about that, maybe I got this completely wrong, so please correct me, but that, for example, some doctors may not know if how much they're allowed to treat somebody who comes with migration background, or like, can I do that, or which way do they have to go to access this kind of what they're asking for? Like that also there's like a lack of information, not only from the side of their projects, which are a bit happening maybe outside of the institutionalized healthcare system, but also that inside of the system it's very unclear sometimes. Is that true, or did I get that wrong?
Yeah, that's true. Yeah, absolutely. I think there's no organization that is like that is working on this topic, like that is in, how do you say?
There's like no overstanding organization who's like taking control of this or giving advices or something. So they often completely alone with their decisions.
Okay, Inga, you wanted to say something? Yeah.
Yeah, but I wanted to just also connect and try to phrase a question, like, because I have the feeling that maybe the German healthcare system is a very good example of like completely failed communication design, right? Because most of us have the privilege of having grown into it, and that means it's somehow happening. But if you have to learn it from the outside, or you have to learn it again or new, it is extremely problematic, and able-bodied people often don't know about all the downfalls and the like really harsh discriminating acts that can occur in the healthcare system. So on one hand, I think it is very important, if we have that privileged insight, to make this a conscious knowledge that the healthcare system is very exclusive and is making access very difficult. We created a zine on how to enter the Künstlersozialkasse, the artist health insurance, because the artist health insurance forms are very intimidating, very complex, and they're all in English, and they insist on keeping them in German. I'm sorry, they insist on keeping them in German. So I wanted to briefly ask, like, I think Sickness Affinity Group is meeting each other in a support network in order to share the lived experience we have had with the healthcare system, and also with ways to help each other outside of the healthcare system. And Formate, this Dialogs, is thinking about how can we at least address the fact of the inaccessibility of information. But I think Power Makes Us Sick has really been working on a model how we can actively support each other in very difficult healthcare service conditions, where healthcare is more and more privatized or just basically not accessible for a lot of people. And you were about to introduce this earlier, so maybe you have a minute to talk about the accountability model. Maybe we can talk a bit more about how we politically position ourselves towards the healthcare system.
Thank you, Inga. That's perfect. I wanted to go back to that. So would you be able to say a bit more about this tool?
Yeah, absolutely.
Yeah.
So,
Sorry.
You want to go?
Oh,
okay.
I was just going to say something before you go into the explanation, that I find it really interesting the way that location and our circumstances around where we're working from geographically shapes the angle that we take when we look at these things, whether we are more focused on access to the existing systems versus what we can build on our own, with the reality that a lot of times accessing those systems is very difficult to virtually impossible. Like I'm in the United States right now, so the angle that I take is often many of us are losing access to these existing systems. What can we build outside of them from like a harm reduction standpoint that can help people survive when access to conventional medical care becomes no longer an option. So if you want to explain more about the accountability model, I just wanted to observe that.
Thank you.
Yeah, so that's actually kind of getting into so one of the things that I would say about the accountability model, because I don't know that there's time to fully detail how it works now, but it's essentially a model for sort of like working with small groups of people to do this, who are accountable to, one person being accountable to your mental health, person being accountable to your physical health, and then another to your social health, to sort of like help do that research and go through the process to understand what you might access from the institutions of medicine that exist for you, but also perhaps what we can do if those options don't exist, how we can fulfill the needs or solve for different things outside of that. But yeah, really, I think one of the things that motivates that tool is not only seeing how that has worked, how similar models have worked in the solidarity clinics in Greece, but also kind of like other initiatives here in the US that are really inspiring to us, that come out of like the Icarus Project, right? And how people have self-organized to offer each other kind of like emotional support in times of crisis, or to prepare for those times of crisis, so as to avoid hospitalization and criminalization. And I think also just our personal experience as, many in the group, we have traveled, or just been in support of other migrants, right? And know what that might mean to not necessarily in any given situation have access to a stable clinic, let's say, or to a clinic that's located in one particular space, or resources that are located in one particular space or location. So how can we kind of like rely on what's already happening with our, in our lives, which is that we have these relationships with people and individuals that extend through time. So how can we make use of that in a way that also kind of like helps to solve for the other things that might be ailing us or affecting our well-being, if that makes sense. I don't know if I answered the question, but yeah.
Yes, absolutely. Absolutely. Thank you. I'm just going to say, because you're sharing, you would like to share your website also, and actually you also have a website as actually all of you have, which is quite accessible in terms of that you offer a lot of resources, and you offer you also offer a lot of your zines and a lot of your, for example, because you were just talking about emotional support, have this poster about like first aid, which I think is really nice, because you can just like print it and have it on your wall, or have it somewhere to offer information. So I'm just going to share that with all the attendees, if that's okay with you.
Yeah, I think I already sent it to panelists and attendees, but in the chat there's a link to Power Makes Us Sick website and our zines, and
you did already.
Found under the resources tab there.
I'm not sure if people can see. I don't know how
Yes,
how technology works.
They can. Thank you. I didn't see you already did that. Great.
Okay.
Cool.
Good. Yeah.
Perfect.
That
Thank you. So I just wanted to see, is there any other question that we would have? So is there a question from audiences, or from any other of you to each other? Ivan, yeah?
Maybe because you just told us about the zines and posters, and I also had a closer look on your website, PMS, and what I found really interesting is that you spread all your material, your poster, and ask people to print it out and to spread it. And maybe there's this question for me, so if I'm now sitting here and hearing all your interesting methods, how can I do something? How can I support, or is there possibility how I could join your groups? How are you working in your groups? Can I just print out some zines, or maybe you can tell us something about this working together also in a collective way, as I heard that some of your groups are knowing each other already. So maybe PMS or someone else can tell something else about the collective work and also the workflows between other collectives and groups.
So we'll just start with that. We actually have, speaking of the website, we have a tab on the website for how to get involved that kind of details, some various ideas about ways that we imagine people could get involved if they wanted to. But also we're trying to, at the moment, formalize, oh, sorry, my cat is, okay. We're trying to formalize like a process for how people might actually become involved in the collective, because as of now, we just sort of are involved with people that we trust, or with people that we have met, or that we've done work with. But we want that to be more available to anyone. But we also want to be aware that we're sort of working with things that might be sensitive, like people's healthcare, that's sensitive, offering health care in some of the ways that we might do, you know, could be illegal because, well, there's a lot to be said about that and why that is. But anyway, I think that like there's some sensitivity around it, so it's not entirely so open to like literally, you know, our individual meetings are not going to be like literally open to everyone, but we're trying to make that more accessible now. And yes, you can find out more information about other ways of getting involved on the website, but I would be very curious to hear how that works for all of these other groups as well.
I also, just to add that I mentioned in our introduction that we always want to hear from people who are looking at our tools and resources. So if people have responses, report backs on various autonomous health practices, want to share information to share, we are always interested in hearing from people and corresponding with people doing this kind of work.
Yeah,
I was reading in the chat that there's a question.
Exactly. Is that a good moment? I don't know.
I was wondering if we can maybe connect to this.
Yeah. Do you want to read it out or shall I?
You're welcome. Yeah, please.
Okay, so I'm just going to read it out so it's kind of here present, because I also thought it's maybe a bit connected to it. So there's a question from the audience about how you organize and finance yourself. So do you rely on funding? Do you rely on voluntary work? Do you cross-finance? And also with a further question of how are your experiences on setting up your groups, organizations, projects in regard to that? So I guess it's also, thank you, Inga, it's very much linked to it.
It's funny because I was reading another question on the chat.
Oh, really?
I think maybe we have two different channels. And the question there was how the groups are using formats, that there's the format of the zines and whether we can specify what we're doing in the workshops. But
cool, now we have many questions at the same time. That's also good. So feel free to speak on any of those. So if you're looking at these different formats you have of zines, of printed, or workshops, and maybe tied into that also, how do you finance all of this? How do you finance these projects? How do you do that?
I would just like to maybe pass on the question to Zach, because Sickness Affinity Group was just doing a project on zine making, because I think this choice for zines has a lot to do with what resources are available to us and how we think we can circulate information that we gather and how we can do that in a more independent way. And there's a lot to say about precarity and like bad working conditions in the art field, but maybe Laura, you can share something about the workshop.
So SAG is completely unfunded at the moment, or project-based funded. So if we get offered funding for a project, for example, but the hardest thing that we that's to find funding for is to maintain our bi-monthly support group meetings, and that's probably really our core activity. And also it does take up a lot of energy and a lot of people to take on the different roles, to care for access needs, to do timekeeping, to respond to emails, and now to also take care of the technical elements. And this is because this isn't really an arts activity. This is like a very difficult thing to find funding for. And it's often hard to try to include it within arts funding budgets that we get. We did recently, as Inga mentioned, get the Dirk Starten grant this year, where we ran a series of workshops on zine making. And this was run by different members of the collective and had various themes. So together we created a zine library, and we gave an introduction to zines and zine making. We also talked about the accessibility of zines. So again, going back to the fact that like online information isn't always the most accessible information, especially to the most marginalized groups, and often having you know, publications which are made with little to no budget and very DIY. These can be made easily, and then they can be put in spaces where people can access them, like community centers, community healthcare centers, alternative type libraries, and social spaces. Yeah, I feel like I've lost the train of the question, sorry. But yeah, regarding zines, yeah, we did a series of workshops, and these are finished now. But there is a website online where all of the kind of documentation from the different workshops will be placed.
Yeah, Sophie?
Yeah, first towards formats right now, we have our publication, not only printed, but also in a digital version, which we would also like to share here, but it also will be soon on our website. It's just in German, but maybe you also want to have a look at it. And towards funding, we are just quite lucky being students and also being supported by our parents. And this privilege allowed us to continue our project and not to worry that much about financial issues so far. But I think this will change soon.
Yeah, and we're pretty unfunded. Honestly, you know, many of us in the collective like are sex workers, and that's where a lot of the funds come to print things if we need to. Otherwise, we try to actively work on, you know, divesting from arts institutions whenever possible. So this goes a bit back to the question from earlier. Mm-hmm. About the arts and this sort of thing. I mean, for us, you know, like when it comes to offering care and support, I mean, this is the question from earlier. I guess it's sort of like, you know, we care for our friends and comrades, right? But the institutions that seek to ultimately make a name for themselves off of like our work, you know, those are not necessarily always, you know, we don't necessarily have to have allegiance to those kinds of institutions. Not that the individuals involved are not, you know, it's not a different story or something like that. People we want to make relationships with. But I think like, yeah, something else that's important to think about, I think, is just like, there are many groups that we might want to work with on the ground who might not want to be involved with people who do take money from the state or certain kinds of banks, you know, or institutions that are funded by certain banks, etc. Because that is sort of like tacit support of those things. And so we try to be very aware of that, and we try to not accept funding from certain, you know, decline opportunities and decline funding in those cases, but also, you know, if that's not what's happening, or if we are accepting any kind of funding, which isn't really happening. I mean, what we're talking about is like funding being like a $50 fee for like 4 hours of our time or something, you know what I mean? So if that happens, I mean, we like to totally redirect that into like the materials for some of the mutual aid projects that we would do on the ground that we can't fund otherwise. And maybe that's getting a bit off from the question as well. And then I think we kind of mentioned a little bit about the workshops that we're doing when I was speaking, but if people have other questions about that, you can email us. We want to do more workshops and we're happy to. Just invite us. Yay.
Thanks. I'm just getting a little bit away of time because we kind of wanted to go somewhere to German time 7:15. And I know that it's not possible for all of us to stay so much longer than that. So I just really want to say, if there's any last question from the audience, if there's any last question from you or a comment you want to do, then we obviously will take the time for that, but maybe just to like kind of round it up a bit. So is there anything more? If not, that's also fine. That's also really good. I think then for me, it's really just left to say, I mean, I do have lots more questions and lots more things, but also I really appreciate some of you sharing your information on the chat with the attendees, and also saying that you're curious about, you know, getting in touch. So I think if there are any more questions, if there's any more you want to talk about, then just try to get in touch with those people or groups and organizations, or try to get involved with it, with them. And I really want to thank all of you so much for being here tonight, though for some of you it's early morning. Still, thank you for sharing your work, for sharing your time, sharing your voices. And I really hope that, you know, also want to wish you really well for the coming months, because we don't really know what this current pandemic is going to do to us and to our work. And I hope we can stay just creative with that. And I hope that the growing interest in the work all of you are doing is going to be leading to something, as Inga said in the very beginning, to something that brings some structural change with it, though we all may have our doubts about it, but I'm just wishing that in a way for all of us. Yes, and thank you very much.
I also would like to thank all panelists, also to you, Mira, for moderating, and also a very big thank you to all attendees who are watching and listening us. Yeah, we would be very happy to welcome you to one of our following online events. For example, next week on Saturday, 14th of November, we will have an online film screening and talk with Chantal Küng about the work of Doris Stauffer, and we would be happy if you would join us again. And also, we are very much looking forward if we could welcome you in the not too distant future again on site here in the Kunstverein. So again, very much want to thank you, and take care and have a nice evening or a nice day. Goodbye.
Thanks, everyone.
Thank you.
Thank you very much. Just saying one last thing, because there's some people asking if we're going to upload this. We're going to upload this to the YouTube channel of Badischer Kunstverein. So you're also very welcome to re-listen to it or share it with other people. So thank you very much.
That's perfect.
It was so nice to see you all. Very happy to see you. Good luck for the next 2 weeks for those of us who are 8 months pregnant, and for everyone else. Thank you so much. Bye.
Thank you.
So much.
Bye.
Bye.